Well, hello, everybody. It's so great to be with you. Thank you so much for attending the second annual Base Paws Cat Behavior Summit. And right now we're going to stray slightly from behavior, and we're going to talk about longevity, or as we like to call it, the study of biogerontology. But before we get into that, I am going to be the moderator for today. I am Dr. Ernie Ward. I am coming to you live from beautiful coastal North Carolina, where we are having an absolutely gorgeous day with humidity up in the 80s. So it's been a hot one, but I'm here now and I'm ready to talk about longevity. And we're going to ask some very serious questions. And we've got some poll questions and we've got some handouts. We've got some amazing materials for you. But at the end of the day, we hope you'll have a little more clarity on how you can help your cat live the longest, most vital life. But I'd like to introduce our panelists today because it's quite an esteemed one. If you look to that way from me, that is Dr. Julie Churchill, coming to us all the way from the University of Minnesota. She is board certified in nutrition. She is an amazing professor up there, loved by her students, has won nearly every type of academic award you can imagine. And she's going to be bringing a very interesting perspective. She does do a lot of work with feline medicine, nutrition, and of course, longevity. So she's a terrific asset to this. If you go down to the corner over there, that is Dr. Margie Scherk, coming to us from the cold yonder up there in Canada, which is some other country just to the north of the United States, if my geography serves me correctly. She is board certified by the American Board of Veterinary Practitioners in feline practice. She has a wealth of information expertise in feline medicine. That is what she does. And so again, she's going to be able to lend a lot of interesting perspective on longevity. And then finally, just below me, if I'm doing this correctly, is Dr. Heidi LeBryce. Many of you are familiar with her. She is sort of one of the top veterinary dentists in the world. But I know her for the last 20 years. We have worked pretty hard with some senior care initiatives. And so Heidi and I have a long history working with senior pet needs and really trying to promote awareness because, you know, we do believe that sometimes veterinarians overlook the special needs of senior pets. So guys, thank you so much for joining us.
Thank you for inviting us.
All right. Well, listen, I think I am looking for my polls, and let's take a look. I want to start off by asking you, the audience, some questions because this is going to help us sort of as we move forward. And the first question, let's see here, if we go to the polls, is, I apologize. All right. How old was the oldest cat you have ever had? So you personally, if you have a 10-year-old, a 15-year-old, a 20-year-old, break it down, let us know. And I will say this, if you personally right now have a cat that's over 17 years of age, we want its cheek swab. We want to do free genetic analysis on it. We're trying to unlock the secrets of cats over age 17. So if you do currently live with an older cat, 17 plus, let us know because you can get free genetic analysis. This is an important study. And again, I encourage you to reach out to Base Paws because they're going to sign you up in a second. And there's a couple of options. So let's take a look and see if we get any results here, guys. I'm assuming, whoops, here we go. We're going to hit this. All right, so now tell us how old your oldest cat ever was. And panelists, Julie, what's the oldest cat you've ever had?
23 or 24.
Yes, that's amazing.
My own
what about you, Margie?
Cat, 21, but in practice, the oldest cat I cared for is 20.
That's another question. That's later. That's later. Heidi, what about you? What's the oldest cat you've ever owned?
My current one is 16 and actually doing pretty darn well. So I plan on keeping that rolling.
Wow, that's great. You know, and here I am, a guy who does a lot with longevity and obesity, and the oldest cat I ever had, Freddie Cat at 19. So I feel like I'm deficient with you guys, but let's see how our audience is doing. Holy cannoli, guys. I am loving this. Look at the number. We've got over 65%, roughly more than that, have cats that are 17 and older. Congratulations, you guys are doing great. You should be giving this lecture, I think. I love that. And this again, you know, panelists, just goes to speak, you know, we are serving older and older pets. I mean, certainly, you know, Margie, I think in my experience, you know, when I look back 30 years ago, I didn't see very many 17, 18, 19-year-old cats.
Well,
would you agree with that?
Getting a lot older, but it is very regionally different. not just with respect to disposable income, but also simply cats being at risk for different conditions. But yes, in the past, when I was growing up, an old cat was 12 or 14, and now to me, an old cat is somewhere north of 25.
Okay, I totally agree. All right, let's see if we can pull up another poll here real quick. I apologize. This is harder to do than it looks on TV, guys. Let's see. Okay.
Don't try this at home.
That's right. Let's see. How do I get back to the other question here? So I guess we delete that and then we go back to it because I have one more question I want to ask you guys. This is too many steps right here. All right. You know what, Casey, I know you're watching us, so if you could maybe somehow help me if you can, because right now I'm not seeing our polls popping back up. But let's start off with some of our questions. And again, audience, we are here to take your questions, so I will be doing my best to monitor that. I love this. Holly is talking about 2 cats, 3 and 2. So I'm going to be watching these questions pretty closely, and we'll hopefully that will guide us. But I want to start off with a question to my panelists that I think is going to be pretty salient to today's conversation. And the first thing is, in 2021, what do you think is a reasonable life expectancy of a cat in the United States? So maybe Margie will include Canada, but I know you were saying there are geographical differences. But general terms, what do you think an average or a good life expectancy should be? I'll start with you, Heidi.
Okay. Well, our poll question came up.
Oh,
so do
there
you
we go.
want them to say something
That's
first?
what I was looking for right there.
Let's do that.
Okay, so what do you think the current average life expectancy for cats in the U.S. is right now? 12 to 13, 14 to 15, 16 to 17? That's where we'll stop it. I assume that is sharing, right? Can you guys see that?
Yes, we can see.
Okay. Just making sure. So hopefully they can answer that. I don't know if that's live out there. 0%. So we can see it, but I don't know that the audience can participate yet. So again, we will kind of just park that there. But let's get back to you, Heidi. So average life expectancy in the U.S., what do you think is reasonable?
So as you look at average, you have to figure in those that maybe get into accidents young and maybe those that have issues. I'm going to be realistic and go for the 12 to 13.
12 to 13. Okay. Julie, what about you?
I'm the optimistic, maybe not realistic, but I'll shoot for the middle, 14 to 15.
And I'm
all right.
shooting for
And Margie, what about you?
Because I know the data is 14 to 16. So it is 14 to 16. Yeah.
Right. So 14 to 15 was the closest that we could come on this particular poll. So that is the current life expectancy. So, a lot of times when you hear veterinarians say, well, 15 years of age, and then when it's a 17-year-old, they're going, wow, they've exceeded the life expectancy. And I'll be the first to admit, panelists, that this data isn't the most robust. It's what we've got. It's as good as it gets. I do think we could do a lot better, and that's one of the things that I've been working on the past several years to try to get some type of actual mortality reservoir so that people would actually report when their cat or dog died. So I think that we need to start there because it's a hard question. But let's dig into that a little more, Margie. So 14, 15, 16 is kind of the typical. What are the big limiters to that?
If I may, I just want to say one of the limitations of us knowing what getting this data is, we don't actually know how old our cats are when we get them. Because, even with kittens, we're guesstimating, unless we actually know the day they were born, we're guesstimating as to how old they are. And certainly if a young adult strays into our home or we adopt an adult, we're guesstimating. So we don't really know that. But the main limitations, in answer to your question, Ernie, of longevity are chronic conditions. Certainly, chronic kidney disease being right up there, and then some endocrine conditions such as diabetes and hyperthyroidism. But those, are probably the main ones. But we also need to be very aware that euthanasia is the #1 cause of death in our companion animals, and therefore we need to be very selective as to when we apply that terminal treatment, because we don't know who the George Burnses are, who are the individuals. Sure, the average life expectancy when George Burns was still smoking cigars at about 101 or 102 was something like 70, but just that doesn't mean that in that he was that exception to that rule, just as there are the exceptions to the rule. Every cat is an individual, so remember that.
Okay, good. So Julie, anything you'd like to add to that? Sort of what are some of the current limiters? Why is it stopping at 14, 15, 16?
Again, I think that it's going to be increasing, Ernie. So the limiters are, as Margie said, a lot of those conditions and really those factors that contribute to impaired quality of life that lead to that ultimate decision. But I think there's great potential if we start early and often in the way we manage. That's why I'm shooting for much higher age range in the future.
Yeah, excellent. And, again, Heidi, anything you'd like to add? I mean, from a dental perspective, obviously, I'm sure periodontal disease is one of those chronic conditions that limits.
Right. And Dr. Julie hit the nail on the head. If we can catch these conditions earlier in the process, that means we can manage them much more effectively. And that means getting your cat checked out on a regular basis, including blood work and blood pressure and everything else. And of course, dentistry is extremely important. There's even going to be a panel just on teeth coming up. But there's some really interesting facts now about inflammation and aging. So taking care of any of those inflammatory processes, whether it's osteoarthritis or bad teeth or chronic renal issues, can make such an impact on their quality of life, like we were talking about, that, I like the term health span versus lifespan.
Me too.
Yeah, and that came up in the question. Certainly, I don't know that hopefully that popped up. I can't see it now on my screen, but this is an excellent part to discuss, because we are talking about life expectancy is actually what we're talking about. I mean, obviously increasing lifespan is a slightly different thing. I know there's a nuance here. We have a geneticist who's asking a question where we're referring to life expectancy right now. And so for us, lifespan is a different thing. Obviously they're doing some, different types of manipulations to help extend the lifespan. But for us, it's really still about life expectancy. And more importantly, it's the compression of morbidity. I think, Julie, this is something you and I have talked about exhaustively over the years. We really aren't interested in just increasing the number on a calendar. We're actually interested in increasing the quality of life and the compression of morbidity, or squaring off the curve of morbidity, as Dr. Cooper used to say.
We want them to thrive,
There's
not just survive.
A really wonderful book on this topic regarding for humans is called "What Makes Olga Run," and it's really about this is about a woman, a master's athlete who started track and field at age 77 and won all the records into her early 90s, was beating all the records. And so it's fascinating, talking about what Catherine had asked in that question, talking about telomere change and things the different things one can that are believed to have an effect on telomere damage and antioxidant or oxidative change and the like. And it's written in a very, very readable fashion. But certainly, as anything we can do to reduce inflammation, because even though we have been taught that the body is made up of all these different systems, and we have gastroenterologists and we have dentists and we have dermatologists and all these sorts of different groups, that's not how the body works at all. What's going on in the mouth talks to the joints. What's going on in the joints talks to the kidneys. What's going on in the heart talks to the pancreas. Everything is interconnected. And so for optimal health, that's why, we need to look at the body as a whole: hydration, nutrition, exercise, and with cats too, getting some, getting movement in these guys as well. But hydration, nutrition, identification and alleviation of pain, and meeting behavioral and environmental
Yes.
needs so that they are not stressed, because health is, as Dr. Heath said in the first panel this morning, health is composed of not just the physical, but also the cognitive and the emotional. And with that, with an imbalance in any one of those, you don't have health. And so we really need to look at it as a whole, and as a whole body as well. So.
Yeah, and as I've always said, health is not the absence of illness, and I think that's where we're getting into quality of life.
Absolutely.
And so, panelists, what I'd like to do now is also kind of talk about the role of genetics. So, what role do genetics play in longevity and environment? So, I'd like to start off with you, Margie.
Well, there's sort of a genetic roulette there. It's like anything else. If you may be predisposed to certain conditions based on your inheritance, but it's not just genetics alone, because there's the epigenetic effect, and that means the effects of the experiences you have, not just psychologically, but and emotionally, but also physically. In that we know that longevity, blood pressure control, risk of heart disease, all sorts of things, and risk of like even things like schizophrenia in people is you are affected by what happened to your parents and grandparents, and especially with the famine, exposure to famine, be it the famine in China, 59 to 61 or something like that, and the famine in the Netherlands at the end of the Second World War. The effects if the mother was if you were in utero in the second trimester, during that period when your mother was starving, you will never recover from that as an adult after you hit the ground. So lots of different things, and we believe that the similar things occur in cats with respect to idiopathic cystitis, and inflammatory bowel disease, and other chronic conditions may be affected by the stress on the queen. If the queen was if there was she was creating a lot of stress hormones, then that affects the adrenal health of the fetus, and therefore of the kitten once they're born and throughout their life. So that's epigenetics.
Okay, so I'm hearing yeah. So a lot to unpack there. Julie, what about you? Nature versus nurture, the role of genetics and environment and longevity.
So I think you can't separate the two. We know there are breeds of cats that are known to live longer. So again, I told you that I had one that was 24. I've had several in their 20s, and they were all Siameses. So we know that if they don't get bad disease, they can live really long lives. So of course genetics plays some role. Do we understand it exactly? I don't think we do. And then again, environment and so many other factors even nutrition, of course, can then impact the expression of genes.
Absolutely. And same question for you, Heidi.
So as we start looking at the genetics, and my husband was just filling out his medical records for a surgeon, that, the grandfather and the mother's father and all these lines. What about those cats that we adopt that we don't even know how old they are? We have no idea from their past,
right?
Unless we look at certain aspects. So while it certainly plays a big part, there is so much that can be done within the environment, with the nurturing, that can really help manage chronic conditions. Health, nutrition is huge, Julie. You mentioned hydration, Margie. Oh my gosh, is that not one of the key things with cats? And environmental enrichment. Some people think cats are pretty easy because they sleep all the time. Well, they need a little bit of interaction there. They're not as easy as we may think.
They may be sleeping all the time because they're bored out of their trees and there's nothing else to do. And there's a lot of depressed cats out there too.
Yeah.
Yeah, absolutely. I totally agree. So while we're on the topic here of genetics and environment, and everybody now is in agreement that, the epigenetics of it actually plays maybe the bigger role here. So the influence of the environment on the genes is actually probably the key to extending longevity. What are some interventions that you recommend? So Margie, again, we're talking about trying to extend quality of life, longevity. What are some of those interventions that you think
nutrition
are
plays a
prescient
big
to this
role
discussion?
here, and using having feeding diets that are well balanced, that have antioxidants in them, and omega-3, 6 fatty acids, antioxidants such as having sufficient, not excessive amounts of things like zinc and vitamin E and vitamin C, these sorts of things. But you want to make you're much better off, and I know I've been trained well by Julie to be thinking about looking for a complete and balanced diet rather than using supplements, because as soon as you start adding supplements, you may in fact be causing a nutritional imbalance by having too much of something. These things are called micronutrients because there's a very small range that is optimal, and too little is bad and too much is bad. So making sure that we're using complete and balanced diets, that can make a difference. And I know that, Julie will have lots to add to that.
Okay, well, Julie, add to it.
I'll try not to add too much because this is my jam. So it's really about feeding, again, an excellent quality food. If I get to be king for the day, it would be multiple forms of foods, because those food preferences are formed early. We can change it later, but then I like them to be what I call a little bit more food flexible, because it's really a battle to get water in seniors. And all seniors need more water because their sense of thirst declines, and cats on a good day aren't very good drinkers. So trying to do that. And again, I spend more emphasis on picking the right food than trying to fix it, as Margie said. And then the big thing is not just picking the right food, but feeding the food right, if you will. So to maintain an ideal lean condition, and as they enter their middle age to early senior years, the monitoring really starts. The best preventive is early detection. And what we know is cats enter the second half of their life, that weight loss is the hallmark, the biggest marker for something's awry. And that's when we jump on it with diagnostics, a deeper dive, and an intervention sooner.
And Julie, while we've got you, no surprise, the chat board is lighting up with, well, how do you know what a complete and balanced diet is? How do I choose the best food for my cat? There's a lot of that, as we're used to. So would you like to address that?
Well, if you really, so I won't try to monopolize the time. I will always send you to your primary care provider, because it's not just the food that I tell you today. I don't know your pet. I'm a big believer in individualized nutrition. So your healthcare team knows your cat, and they will steer you to a complete and balanced product that matches your cat's needs. And again, the great news is there are many hundreds of wonderful choices. And so that's my elevator level answer.
Margie, Heidi, you want to join in on that? Because again, we're seeing lots of questions. In fact, somebody saying we don't know nutrition, but you are a board certified nutritionist, Julie. So thanks for your comment.
Well, she definitely has the whole, she has a nutrition thing. And the more I get into senior care, the more nutrition seems to be so much a part of it. One interesting thing about cats, so us and dogs, our energy requirements continue to go down as we age. Cats start to go down, and then it goes up again. So if you think, I should be eating a few less calories, the cat doesn't need less calories. And in fact, in most cases, other than those that may already have some renal issues, they're probably going to need some pretty decent amounts of protein too, which is really essential. So cats' metabolisms they're dynamic. And let's face it, I'm convinced that cats are from another planet. That's why they're different from everything. And so again, but the individual issues are what are so key. And that's why you need to work with your veterinary team Because sometimes there'll be a veterinarian and even a technician who has gone those extra steps to really learn more about good nutrition, because there's actually no standards for senior pets for nutrition.
Right. And Julie, one of the things too, I think it's important to note that as cats age in particular, their ability to metabolize proteins decreases, which really does change their nutrient composition.
And fats as well. Ernie, can we just have a look at some of these slides? Yeah, thanks. Do you want to just pop those up there? And
I can. I'm going to see right now. I do not have. Okay, I'm not able to see that.
Let me just do that if I may. Then, oh, there you go. Fantastic. Okay, so this one shows exactly what was just mentioned, is that as cats get older, they're, once they, like up until about age 10 or 11 or 12, their metabolic energy requirements start to decrease, which means that they're more likely to get fat if we don't, if we keep feeding them the way we did. And in fact, even if we feed them the same, the appropriate amounts for their weight, what we see is that the percentage fat first increases, and the percent of lean body mass, so that's muscle and skin and bones, decreases. But after age 12, that reverses, and it's really interesting. And the next slide shows, Ernie, if you don't mind. You can't do that?
I can't.
Okay, so somebody else is, there we go.
I can't even see
the
it.
Next
So
slide
hopefully
was,
Casey's
we've
driving
skipped
it.
a
Thank
slide
you,
there
Casey.
somehow. There we go. Super. This is really interesting, and this is what Heidi was referring to, is that in the green bars show cats and the blue bars show dogs, and what you see is that the percentage of cats and dogs who are underweight, based on the age that they are, ages at the top, and underweight, and you can see that 0 to 5, they're all about the same, and then you can see that cats start dropping weight far more dramatically than dogs do as they get older. And the next slide then, please.
Before you go, Margie, I just want to point out too that what sort of the middle age range, cats are very obese prone. And so, but don't put that weight on in order, like you're not paying it forward.
Right. It's not protective.
No.
The next slide, please, which shows the time before the time before death. You actually see, if death is at 0 on the far right hand side, they start losing weight about 2.5 to 3 years before they die. In fact, what was interesting too is some work done by Dr. Freeman, and it showed that they start losing weight even in cats with chronic kidney disease before we see the changes that allow us to make the diagnosis. And that happens also through other studies with different types of cancer and with heart disease. So body weights, weighing cats, the importance of that cannot be overemphasized. Which sort of takes me then to not the next slide, but the one after that, body muscle condition scoring.
Margie, can I add to? So again, even if a pet is overweight, it's unintentional weight loss should be a big red flag to the healthcare team.
And so there are these two things, and I think in the handouts you've got there is a handout available from the World Small Animal Veterinary Association, which is WSAVA.org, and they have these two things. One's called body condition score and the other one's called muscle condition score, and they're different. In what body condition score, it tells you if the individual cat is getting enough calories, too few calories, or too many calories. And I think that's fairly obvious on that top chart. But the reason we also want to look at muscle condition scoring is because muscle condition scoring tells you, how many calories are coming from protein. Like, is this cat getting enough protein in their bowl? Is this cat able to metabolize and digest and incorporate the protein from that diet? Or does this cat have a condition where they are using up more protein? They need more protein, or they're losing protein. So the next slide to magical person in the back who is changing these, shows the difference in muscle condition score. And so looking at if your cat is losing body condition or losing muscle condition, those should be big red flags, and good reason. Even if they're acting completely normally, you should get them in to have them checked. And remembering that some degree of muscle loss is a normal age-related change. It happens to all of us. It's called sarcopenia or poverty. Yeah, I know, wah, wah, right? Poverty of muscle, but it's still poverty of flesh. Pardon me?
Except for Ernie.
You're muted. Except for Ernie. Yeah, exactly. That's right. Well, Ernie's not old. So it's this is something that you can assess sort of by feeling. Like normal on the top left is what it feels like if you touch along, when you're stroking your cat over their head, over their back, and over their hip bones, as well as looking at the muscle in the thigh area. When you stroke them over their head and back, you if it feels like as it does when you stroke down the inside of your hand, if that's normal. If there is mild loss, you like turning your hand over and stroking down the muscle, your knuckles, but with your fingers flat out, that's a moderate loss. If you've got if you bend your hand a little bit and you stroke over your muscles, that's a moderate. Sorry, previous was mild. Moderate loss. And if you make a fist and you stroke over your knuckles, that's a severe loss. So that's a way you can gauge. But if you're noticing a mild muscle loss, the time to pick it up is early, because it's hard to put muscle back on nutritionally. Cats don't do a whole lot of weights and resistance training, but getting through nutrition, even and Heidi mentioned kidney disease, and Julie and I can discuss this till the cows come home. With kidney disease, cats may actually need more protein if they are not absorbing it adequately, and the body never tells a lie. If your cat is losing muscle, they need more protein. It's that simple.
Or an evaluation.
Exactly.
Yeah. Exactly. So good discussion there on that. We did see a lot of questions, and I'll direct this one to Julie, if you don't mind, about how much protein do they need? Obviously, this is going to be life stage dependent, but any general advice?
Yeah, it's a little hard, unfortunately, for pet parents to discern this, but it's generally, I start at 2 grams of protein per pound of body weight. And unfortunately, the way the pet food labeling law is, it takes some mathematical gymnastics to get to that. So again, I'm sad to see some of the comments that say my vet doesn't know how to do this, because you're like hurting me. I teach this stuff, but the vet care team should be able to help with that.
Yeah, and again, if you are struggling with your personal veterinarian, there are veterinarians that are very experienced and accomplished in nutrition that are out there. So, I mean, I encourage people, if you're not having those questions answered to your satisfaction, find a veterinarian who will, because, honestly, the hallmark of health and longevity and quality of life, to me, begins with a good foundation of nutrition. So I don't know, panelists, any thoughts on that about finding a vet?
I think you
can help.
Your vet every veterinarian has different interests. And so your vet may be absolutely fantastic for all the other aspects, the chronic kidney disease, the whatever else, the dental care, but just simply not have the interest in nutrition, in which case, you can get a consult in nutrition through seeking someone from the American College of Veterinary Nutritionists, and get a consult there. You don't need to abandon ship and look for another veterinarian. You've taken time to develop the relationship with them, and you want to maintain that.
Yeah, that's a good point for sure. So you can always try to find 2 vets if you want to go that route as well. I'd like to kind of continue on this, interventional type of questioning. So Heidi, you and I are coming at it from a perspective of general practice. Typically, I mean, obviously you're a dental specialist, but you also work closely with general practitioners such as myself. What are some of the interventional, steps that we like to take. I mean, I'm going to dig into diagnostics, especially predictive diagnostics. So maybe I'll let you start by, opening up some of those types of approaches that can help extend quality of life and longevity.
So we know that cats aren't necessarily the easiest pets to get to the vet clinic. Okay. So we need to kind of work with the vet clinic. There are certain methods we can use, even some mild medications that can be used to help relieve that anxiety for cats. But it's important to get your cat to your veterinarian, or if you have a mobile practice, to have them come to you. And as they get older, it's important to do that more frequently. To get baselines with blood work when they're young and healthy, mature and healthy, blood pressure, urinalysis, all of these things are critical. A good physical exam, listening to the heart, looking at the mouth, palpating, looking for that muscle loss, looking for the body fat, everything else. Because most cats that are presented for an illness have already lost significant amounts of weight. So be preventive, go with wellness, make sure you continue with good care. It's, cats can be kind of quiet at times, and it's sometimes easy to miss that 6-month time that we should be getting them in, yearly time, things like this. But having good preventative wellness care is extremely important. Studies have shown when the blood work is done on healthy adult to senior cats, problems are found at the early stages. So we need to be proactive with that.
Yeah, and that's really important to point out again, to the attendees today, because when we can identify a chronic disease such as thyroid disease, chronic kidney disease, liver, and a long list of these things, even many cancers, of course, we can intervene more successfully. So meaning that if we diagnose kidney disease at the very earliest we can detect it, using a combination of maybe tests like, a urinalysis with SDMA and creatinine, right? So we can find it at the very earliest onset, then we can make modifications to the diet and then maybe prolong the quality of life and certainly slow down the rate of kidney disease progression. So Julie, maybe once again speak to those tests that they need to do. So now we've got a cat that's 9 years plus. They probably need to do some basic tests every 6 months or so. What do those tests on your list look like?
Right, and Margie entered some in the chat too, what we call full biochemical profile and a complete blood count. We add thyroid too as our baseline, and don't forget the gold. Urine is essential at that same time of collection, and that gives a very good beginning comprehensive view of where we are at baseline. And then generally once they enter the senior years or the second half of their life expectancy, I think they should be seen every 6 months for probably that same amount or maybe an abbreviated version, but including the urinalysis. And then sooner, if you notice anything that's awry.
Yeah, Julie, just while I've got you here, I think one of the things that many cat parents fail to appreciate is just how rapidly kidney disease can progress. And again, I'm kind of sticking with kidney disease. I think most of our audience is asking questions around CKD, but there's a big difference between a yearly test in a 12-year-old cat and an every 6 months. Could you speak to the importance of the more frequent testing because of the rapid acceleration in the disease?
Yes, and again, because many of those foods are stressing high protein, but depending on how and who formulates it, we're really learning a whole lot more about what is the right amount of phosphorus, because that's really the key. And I know that there's some lists that are published out there, and I don't even think they're all that reliable, but that can happen very rapidly depending on what they're eating. And if we're not looking, I don't see any problem, because cats are great disguisers of disease, and they can look great on the surface. It's hard to notice a little bit of increase in urination if they're, and so things can happen pretty quickly. So monitoring is key.
And Julie, just real quick, because you did mention phosphorus. I mean, one of the things I've been frustrated the past several years is just the testing methodology. Many times they're reporting based on formulation, and that phosphorus level may be very different in the finished product. Could you speak to that?
Right. So again, I tend to recommend companies, manufacturers that fulfill what are called WSAVA criteria, and you can search online. WSAVA, World Small Animal Vet Association, makes some criteria to be a great start for picking a high quality manufacturer. And then there are many, many excellent products within that realm. But the other thing, Ernie, too, is that we're still learning too about the form of phosphorus.
Right.
And so again, those companies that are really doing high quality control standards, testing ingredients before it goes into the recipe and testing that finished product. And those companies that fulfill those criteria do that excellent, hundreds of QC checks, but especially the finished product.
Yeah, it's really important. So Heidi, several times we've heard from the panelists that hydration is really important. Maybe could you talk about that? Because that's something that any cat owner watching today can certainly intervene with. So what are some of your tips?
Real quick,
how
Margie
much water
has
should a cat be drinking and so forth?
Answer you. Okay, so I have 3 cats. Monitoring water intake is kind of interesting. I was at the recent palliative and hospice meeting this past weekend, and there's now a water device that measures cat water consumption based on their chip. And you're talking they can measure up to 32 cats. Mm-hmm. The thing of it is, when you look at hydration and dehydration can cause a world of problems. I mean, from, oh, you got it, yay! This is the Feel Aqua that Margie was showing. And the thing of it is, when we see some of these diseases, sometimes it's associated with an initial increase in thirst and urination, especially diabetes. How can you tell when you have 3 cats, or renal disease? How can you tell when you have 3 cats who's drinking what, who's eating what, who's peeing what, and kind of take it from there? But that hydration status is so key.
Yep. Again, and Margie, maybe you could also give some tips like that. I love that. And I apologize, I cannot see you guys right now. That part of my screen has gone away for some reason. So I apologize for missing the hand.
The thing with hydration, what I counsel people and find it to be, it's absolutely reliable. If your cat is well hydrated, they will have a nice normal log-shaped stool. Unless they have an inflammatory bowel disease or something else like that. If they are well hydrated, they will have a log. If they are dehydrated, they will have pellets. And it's that simple. So, you know, it doesn't matter if you've got 62 cats in your house, please don't. Or if you have, you know, if you've got, 1 cat, it is, because the thing is, when you look at the delay in skin elasticity, which we look at, I mean, look at me, I'm old, therefore I've got, poor collagen and elastin. And same thing with cats. As cats get older, which is when they tend to be dehydrated, it's really hard to assess their hydration based on their skin elasticity. So you need to be looking at their poop, and the poop doesn't lie. You know, these are really simple things to look at. So the fountain name, sorry, somebody's just asked that again. It's called Feel Aqua. Yeah, thanks, Heidi, for putting that in there. And yeah, it's made by SureFlap, right? Anyway, it's very nice. It comes with an app, so you can see which of your cats has drunk how much per day. Very helpful for monitoring, especially useful for monitoring. I mean, it's fun, but it's especially useful for monitoring cats with diabetes. Let's say they've been well controlled and therefore they're drinking normal amounts of or less water and peeing less quantity, and all of a sudden the water volume that the app tells you that their water volume's increased. That could be a sign that their diabetes, that they've come out of remission or their diabetes has gotten worse. Similarly with chronic kidney disease, you'll see the large volumes of urine in the litter box, the big clumps, you'll see the various things like that. But again, look at the poop. The poop doesn't lie.
Mm-hmm. Great. So Julie, now let's continue on this longevity, and you and I have both done a lot of work with feline obesity over the past couple of decades. Let's talk about the role that obesity can play in longevity. And again, I know that we saw these curves and so forth, but what we're talking about now is the disease state of obesity, where there's chronic inflammatory damage occurring that's affecting all organ systems and cellular level. And so maybe speak to that, so now they've got a 5-6-year-old cat who's 20 pounds. I mean, how's that going to impact their life expectancy?
So dramatically. And again, I think not only because it can increase their risk for what we call comorbidities or other diseases like diabetes and arthritis, but we know that the unhealthy fat tissue in and of itself creates many different substances called adipokines, which are inflammatory mediators. So it's living in the state of chronic inflammation, not just carrying extra weight, which makes it hard on the heart, the increasing blood volume. It's just bad for your whole body system.
Yeah.
When you can achieve healthy weight loss, some of those changes are quite reversible. So it's not too late.
10% weight loss, 10% weight loss where your cat still looks chunky, but 10% weight loss can have huge benefits in health.
Yeah, and Dr. Alex German in the UK has documented, that 6% weight loss in dogs improves the quality of life. So that question about health span and quality, of course, it doesn't take tremendous amounts. The other thing too, since we are having a preponderance of questions around chronic kidney disease, remember that obesity is one of the biggest risk factors for the development of chronic kidney disease. So, it's just something to definitely bear in mind there for sure, because I think a lot of the CKDs that we see are actually the sequela of chronic obesity.
Sorry, one last little thing, because the tricky thing is, there's a lot of adoptions from shelters, and so those little fellows are neutered and spayed very early, and so that just sets them up. It's understandable for population control, but now their metabolic rate is lower because of the spay or neuter, and they're still babies and growing, so we have to monitor them very carefully. Pediatric obesity sets them up for extra fat cells in addition to extra size, and so it really puts them at risk.
I do also want to mention, though, that we're talking about, there's a difference between obesity and overweight. Because just as in people, where there's this thing called the obesity paradox, in cats it's been shown that if you are, if you or your cat are diagnosed with heart disease or cancer, if you're a little overweight, you will respond better to your treatment and have a better outcome than if you are normal weight. Now, that's not to say being obese, but being a little overweight.
I'm gonna counter that, because that data is not exactly worked out. That's just association data that we know that the ones that started a little heavier lived longer. I maintain that we need to monitor that. Really what it's about is unintentional weight loss, and if we prevent that, so we don't really know that, but you're right. Slightly overweight versus obese are different things, and monitoring 100%. Is key, so that you.
And there's a really nifty little trick you can do just to get a better impression about weight loss or weight gain, if weight gain is leading to obesity, and that's calculating a percentage weight change. And a percentage weight change tells you a whole lot more, because half a kilo on me, even though I'll be upset about it, is really irrelevant. Half a kilo on a cat is massive. And so this is why doing a percentage weight change, where you take the previous weight on the top and the bottom of the equation, you take the previous weight minus today's weight, divide it by the previous weight, and that times 100 is the percentage weight change. And that's very eye-opening.
Yeah, and I'll throw a confounding element to this, because I agree with Julie completely. It's actually adipose tissue. This is fat tissue that we're most concerned about. So the term weight, actually, I'm not interested in a number on a scale. We're actually looking at body fat composition. So it gets a lot more. It's the fat, the excess fat tissue, that's creating all of these dangerous chemicals, or harmful chemicals, I should say, chronically. So it's a great discussion. But the bottom line, as far as I'm concerned, is that you really want to pay attention to your cat's weight early in life if you want it to live a long, healthy life. So I think that's kind of where I'll leave that for now. Heidi, getting back to your expertise, it bears really stressing obesity and periodontal disease are sort of two main drivers for chronic inflammation.
And so I put if anybody wants to Google label the term inflammaging, I thought I had invented it, but humans have been talking for a while. Any area that causes chronic inflammation in the body, whether it's adipose tissue, osteoarthritis, chronic periodontal disease. We used to talk about the bacteria would get in the bloodstream, cause some issues. And that's really not the case. It's not taking care of that chronic inflammatory issue that's going on with the mouth that can cause so many problems. And we can measure certain things. It's not that great. We don't have that many studies in animals. I do know as a practitioner that when I clear up that mouth in dogs and cats both, and in fact, periodontal disease and diabetes just love each other and support each other. They're having a bromance there. If you get that mouth cleaned up, you can reduce the inflammation. The pet feels better. And I've had pet parents and referring vets share with me that they've either been able to regulate that diabetic cat better or even get it off insulin once that chronic inflammation is gone. Real quick, we had a question about how to feed with food-obsessed cats. And I have had renal cats, heavy cats, young cats in the same household. So that SureFlap company also makes a feeder that opens up just for that pet's chip. But of course, then I had to put it in a box so the other cat couldn't sneak in at the same time. And there's others that measure specific amounts. Also, you can go with some food toys or things like that when you're feeding individual cats. So they have to either play or work at getting their food, which is much better and good environmental enrichment. So you can really help control those calories.
Yeah.
Yeah, it's just so important. I mean, again, for me, when I look at longevity, preservation of health, quality of life, it boils down to mitigating chronic inflammation. And I think that's really what I want to stress to people, because, you know, my interest in obesity is primarily directed at reducing chronic inflammation. And I think, you know, the same can be said for chronic kidney disease, periodontal disease, and so forth. So, I mean, thyroid disease, for crying out loud, right? So as we kind of near the end of today's discussion, I do want to talk about sort of the future and what might be on the horizon for us, because, you know, I think there's tremendous amount of research and interest in extending longevity of humans. A lot of that is translational from animal models, you know, and so I'd like to talk about that. So Margie, you know, if you look sort of in your crystal ball, what are some of those 2 to 3 areas of research now that may impact the life expectancy of our cats in the next decade or so?
One thing that Julie has mentioned, namely the question about inorganic versus organic phosphorus in foods. I think that's going to play a huge role in chronic kidney disease. Also, the ability to, at present time, no one is unfortunately running this test called an FGF23 to look at what's happening with the phosphorus, because protein's not a problem for cats. It's the phosphorus component of it that the phosphorus component of protein that is the issue, and it's a real catch-22 because cats need protein, but the phosphorus is a problem when they've got kidney disease. That would be one, and I'm interested to see what other people have to say as to what we can look forward to in the future.
Right. So Julie, I mean, I'm sorry, Margie, just to get back to that, basically you're saying, okay, if we can better understand the role of phosphorus in chronic kidney disease, for example, or maybe how it changes with age, there's a test. Do you think that it's going to be the test that might tip the scales in favor of longer life expectancy for cats?
Well, we can, if like with FGF23, with that test, which is not available, so, you know, don't everybody be looking for that one. Is other than in research at present time. With that, if we can detect that before the phosphorus goes up, we might be able to change nutritionally how we what we can do to prevent them from having problems from the phosphorus. Similarly, because by the time we can measure the phosphorus, it's already gone. It's too late to do anything about it.
It's too late.
So I think that's what I'm really saying as far as picking that up early.
Julie, any other types of future interventions or diagnostic tests or developments that you see?
So I would take a whole body approach: healthy mind, healthy spirit, healthy body. From a healthy body standpoint, it's feeding a great quality food and feeding it right from the get-go all the way through life, so that we maintain stable, healthy body condition to avoid that part of inflammation. Excellent dental care throughout life. So a very proactive approach, but also honoring the spirit of the cat. So again, food flexibility, giving them a job, environmental enrichment, so that ideally they have to hunt for their food in some venue, so that not just ad lib, because that's just a lazy way for a cat. I know it's easy for us, but if we can make them have to find their food and gather, it keeps their brain active, it keeps their body active, and I think those are as important.
Yeah, I really agree with you, Julie, about that, because I think we're such an infancy of the care of cats, we're just now understanding basic behavior. So we still have a lot of environmental enrichment that we can do that will give
I
us
think I'm going to go down my inflammation.
What about you, Heidi?
If we can figure out better ways to detect when, and they do this more in people now too, find the markers that will tell us that there's something going on with the inflammatory process, chronic inflammation in our patients. And then once we see that as a broad marker, figuring out what do we need to work with. But on top of that as well, then looking at what can impact inflammation, such as antioxidants, what can impact it appropriately. There's so many things out there that are antioxidants, but they may not be digestible, bioavailable. We might have to eat so much we turn yellow eating turmeric. But what can we do for these cats?
Yeah, I love that. And for me, my answer, really kind of falls into two categories. The first is predictive diagnostics. So whether it's looking at genetic risk factors, microbiome alterations, certainly detecting the diseases that we know about and can intervene successfully, such as chronic kidney, thyroid, liver cancers. I think those are easy. I mean, honestly, if I had my crystal ball wish, I would say to everybody, please, have your older cat tested twice a year, just basic blood and urine test. It would make tremendous. And blood pressure, sure, right? But those are just where I would start, for sure. And then the second thing, I am really excited about some of the drugs that are being studied in dogs and humans. The mTOR, I'm really interested in that pathway. So rapamycin, which has been, in fact, right now, Julie, you're probably aware they're doing an HCM or a cardiomyopathy study in cats at Davis and at NC State. I believe both of those are doing that rapamycin study. So, we're working out like rapamycin safety and dosing and all that. I still fall back on nicotinamide riboside. It's one of my favorite supplements of all time. I think there's a lot of success there. So I do sort of look for what can we do to predict and detect early and then intervene with the simple stuff. But I also am interested in some of the more exotic, unusual, because I think that the alterations of certain pathways, metabolically to avoid cellular senescence, I think is very important. So,
and a build on what you're saying too, I think, and Margie would probably be a kindred spirit, is early identification of sarcopenia, or the muscle loss, and research in preventing that, because frailty, we need more research in frailty too, because that is linked to morbidity and mortality. Can I get to the last slide, please, of the slide set? I really want to show that this picture. It shows about the comorbidities in underweight cats that keep going to the very last slide in the slide set. There we go. Whoops, sorry, the previous one. There we go. So this shows about how more likely cats are to be diagnosed with chronic kidney disease or thyroid disease, or cancer, or arthritis or diabetes, etc. So it's quite remarkable. Keeping the weight on, keeping the appropriate weight and muscle on cats as they get older is very, very important. Somebody had asked, well, if they've done, somebody had done the base paws panel and looked at and found that the cat was free from, PKD or thyroid, should they still be tested for thyroid? Yes, because while genetic tests may show, for instance, in women, that your HERS2 positive or HERS2 negative, being a marker for a particular subgroup of breast cancer. If you're positive, it doesn't mean you're going to develop breast cancer. If you're negative, it doesn't mean you're not going to develop it. It's more of a, hey, this is something, if you're positive, it's going to be like, okay, we need to do boob squishes more often. We need to, check you more often. Whereas if you're, if you're negative, then you can just go with the standard screening. So this does not mean if somebody is testing negative for thyroid, it doesn't mean don't have them tested for thyroid. It means that there's nothing there that's, red bells saying, oh my gosh, this is in your future.
Right. And I think the value of genetic testing in general is to identify, the really patent or obvious risk factors. Yes, okay, you have a high chance of developing this type of, and she's using the example of the BRCA testing for breast cancer in humans. So I think there's value there. Obviously we're still it's an inexact science. And I don't know that it ever will be exact because, again, there's variability in our life. So, it's important. We've really done a good job, I think, of addressing a lot of the questions here. So I want to kind of, as we wrap up today, I want to give you guys my desert island question. So I'll start with Julie. Julie, if right now you could take a kitten, is you and this kitten on a desert island free from threats of predators and disease and all that stuff, what would you do? Like, what would you do to keep that cat as happy and healthy for as long as possible?
So I'm torn here, Ernie, because what I want to do is have the cat be an utter cat and be able to hunt, but I don't want to decimate the prey population on the island. So you put me in an impossible situation.
It's a hypothetical. So there's an abundance of natural flora for it to choose from.
So I will feed them a food of my choosing, but then they're going to get to hunt and be as active as possible for as long as possible.
And Julie, one of the things I've known about you for a long time is you do like cats being able to express natural behaviors. You think that's, part of the dilemma that we have when we put them in these four walls prisons sometimes. Yeah. So, just take a couple of minutes there to talk about that.
So I struggle all the time in trying to find safe ways for cats to be outside. And I know there's all sorts of great houses and fencing, the perfect fence. I don't even know if they're in business anymore, but ways that we can safely allow them to do searching and scavenging and hunting for for some kind of enrichment, because it helps maintain lean muscle in addition to keeping their brain active. And we know that reduces cognitive decline.
Yeah, it's a dilemma for us all, because obviously we can't just have our cats wandering out in the wild, because they would decimate, bird populations and other, natural inhabitants of the area. So the question to you, Heidi, you're on a desert island. You can do whatever you want.
Like
what are you going to do to keep that cat
that I
living
order
a long,
be
healthy,
delivered
vital
on a regular
life?
basis? So I'm not going to have to worry. I'll still let them, get out and about and, play with them a lot to have some good environmental enrichment. I think, not to steal it from Julie, but nutrition is so key. Can I have my own little vet lab there too? Okay, so I want to make sure that I keep up on my regular exams and diagnostics. And then just one cat? Can't I have more than that? Okay, cat house away.
It's your island.
A cat colony away.
Okay. And you like you believe in multi-cat environments. You think the cats are actually more social than sometimes people are led to believe?
There are such diverse personalities. We could have a whole cat behavior summit on that. But as long as there's sufficient spatial area for them and the hierarchy can be acknowledged and worked with, and we can, deal with each cat on an individual basis and go with their needs, I think it works out. I mean, I've always had multiple cats.
I like it.
And it makes for some interesting communications at times.
Yeah, same. Yeah, same. I feel like I've lived a charmed life because I've had multi-cat households and everybody seems to get along. So Margie, now you're on Fantasy Island, or your Fantasy Island with your cat or cats, however you want to do it. What does it look like? What does that life look like?
They want to go. They're climbing trees. They are hunting. They are, but what's interesting is, well, first off, I don't know if you saw on the kitty who was on my lap on Jules, he was wearing a Birds Be Safe collar, which has prevented him from, because he's an outstanding hunter, he still will, and I'm a hypocrite, so he still will kill mice and rats, but he is no longer able to successful at hunting birds. So that alleviates my concerns about that, because, as I say, I seem to value songbirds more than I do rodents, and that which is completely unfair. That said, I also want to make sure that they have like lots of, there was a wonderful study by Nat Geo that showed, National Geographic, that showed on Jekyll Island, actually, which is off of one of the Carolinas, And
Georgia.
okay.
Georgia,
Georgia.
close.
Okay, thank you. Which showed they put cam collars on the community cats. So these are feral cats who have food stations, and they found that these cats actually were not killing birds. The reason they did Jekyll Island is because Jekyll Island is a migratory pathway, an important migratory stop for birds. They found that they actually didn't kill many birds at all. They were because birds fly. They are far more interested in killing rodents and reptiles. That's what, and actually frogs too. So amphibians. So they were far more successful at that than anything else. So I'm not as again. I have a belief in nature balancing itself out. You know, whenever humans intervene, we seem to upset the apple cart, and something else goes wonky. So that's what I would do.
Yeah, it's really interesting because each one of you has stated, you know, something that seems very obvious, but yet I think it goes without being said as often as it should be. And that is the fact that the environment, the lifestyle, the normal behavior expression, like those are the things that we struggle with the most that may be impacting these cats' longevity more than anything, and certainly their quality of life. I mean, so Margie, kind of as we really wrap up today, you know, talk to us about that. I mean, we keep talking about environmental enrichment. We keep talking about, okay, we've taken this cat that is really an apex predator in the wild. We've plumped it down into a home and taken away everything that it knows to be natural. Again, what can we do to try to help them? Because I think there's lots of mental illness that these cats, stress, anxiety, depression, so forth, that accompany them being confined.
Itself as diabetes secondary to obesity in diabetes-prone cats. It's manifesting itself as interstitial cystitis or lower urinary tract disease, which is the most common type of idiopathic cystitis is the most common type of lower urinary tract disease. It's manifesting as asthma. It's manifesting as inflammatory bowel disease, as different skin conditions. It's really a problem. So we talk about it as environmental enrichment when in fact we should be talking about it as meeting environmental needs. We're not even talking about enrichment. We're just giving them, right now they're living an unenriched life, an impoverished life. Essentially, they're living in a velvet lined, and this will drive many of you crazy, but it'll in a velvet lined prison. And as opposed to having, you know, with everything, with a big food bowl and everything, you know, and a clean litter box and that, but we need to meet their environmental needs. And there's a great document on the AAFP website called, which is catvets.org is the AAFP or COM, I'm not sure. And then somebody can check that quickly for me. And if you go under guidelines, you can get to the environmental needs guidelines. And essentially it's, you know, there are 5 pillars to it, and making sure that cats have multiple and separated resources. So lots of, you know, copies of each resource throughout the environment, that they have safe, that they always feel safe. And that includes from other cats or dogs or people or equipment, appliances that make noises, that they have consistent human behavior, that their sense of smell is respected, i.e. that cats need to mark their territory. We can ask them to not mark it with urine though, please, by encouraging them to scratch, using their pad sense and using their cheeks and using things like feel away. And then the 5th one I'm drawing a blank on right now, but if you check that out at the environmental needs guidelines,
and catvets.org has so many good resources. Absolutely.
Yeah, for sure. Well, while we've got you give me a 30-second wrap up. We're almost done, so we'll start with
longevity
with Heidi.
of pets.
I think you've done an excellent job.
Diet,
so Heidi, 30 seconds, last bit of advice for
care,
attendees.
And one of these days I'll find the cure for inflammaging.
Nice. And Julie, we'll leave it with you.
Yeah, it's the same thing. Really, it's start early and often, proactive, preventive care.
All right. Well, listen, I want to thank Baseballs for all they're doing to help us be better cat parents, and certainly to provide better veterinary care from my end of the spectrum here. I really want to thank you guys for your interest in this topic. Obviously, I would say that it's undiscovered territory. There's a lot of interesting research being done right now. There's a lot of different things and manipulations, interventions that are coming. And I think that honestly, the next generation of cats are going to have an even longer life. I am incredibly optimistic. I do think one day we will have a 25-year-old life expectancy for cats. And so again, I think with people like you who are interested and companies like Basepaws and researchers like our panel today, I think we will accomplish that. So again, on behalf of Basepaws and our panel, I'm Dr. Ernie Ward. It's been my high privilege to be with you today. Thank you so much.
Thank you.